I came in here and everybody was saying, all we need to do is build more hospitals. I have people writing newspaper articles all the time. All we need to build is 3,000 more hospital beds. And everybody laughed when I said, we need 3,000 less. This is a mad system. It's unsustainable. Today, I think everybody across the country accepts that we moved to a system of building primary care teams, of having people, so that if I have, as most 80% of our workers are elderly people, most of them have things like diabetes, also blood pressure, also another chronic condition perhaps on top of that. They have to go to a hospital for 3 different conditions on 3 different days.
Yes, yeah.
Generally for tests and for treatments that could be provided to them in their local community. We pointed out that that had to change. People said it won't change. We're now rolling out fabulous primary care teams. I was in Ringsend the other day, we're opening one, where elderly people are there speaking to me saying, this is so wonderful, we don't have to go to the hospital anymore. We're getting our warfarin tests done, we're getting our diabetes tests done. And they're getting all these services within their local community. Now we can start changing how a hospital begins to focus on really serious work, and we get rid of all these waiting times, waiting lists. The HSE, by any fair measure, has changed the whole thinking on the Irish healthcare system, but people seem to think that there was some switch that was going to be flicked. This is a huge challenge to everybody who works, not administrators necessarily, but the entire system was built, from my perspective, on looking after those of us who worked within it, not on patients.
So, Professor Drumm, are you saying then that the initial suggestions that the panacea for the crisis in the A&E wards and all the other problems that were endemic in the old system had to do with a lack of hospital beds, and therefore if we built a system which provided for 3,000 more beds, that would solve it? You're saying that's not the case, that in fact what we need is 3,000 less beds?
What I'm saying is, I said that at that time. All the evidence was that building more beds solves the problem for a year or 2. If you continue with the same processes, the same problem will re-arise. We are going to be an ageing population. We admit far more people to hospital than we should. 50% of our admissions, Karen, are for less than 2 days. Nobody comes into hospital for something for 2 days that they couldn't have had at home.
Why are we building all these new hospitals? You have a co-located system that's set to build 8 new hospitals on public grounds. You have more private hospitals like the Beacon. The Mater Private is there, obviously. They're only expanding in this country.
Let me just say to you that the part of the system I'm responsible for has significantly reduced its beds. In the context of over the last 3 years, we are now running on far less beds, and yet we have reduced, for all the arguments, the A&E waiting times dramatically. Everybody accepts now we still have a problem in 3 or 4 hospitals. The vast majority of our hospitals are now putting through the majority of their patients. We now have time in, time out measures. We have now got under 4 hours in and out 75% of our patients, whether you're admitted or not admitted. That's been done with less beds, not more beds.
So why are we building all these co-located hospitals then?
When people tell me that the HSE system doesn't work, that's a classic example of where it's made a huge change. It's made a huge change in bringing clinical leadership involved. That's what drives it, the change, is clinical leadership. For the first time ever, we measure performance right across the system. So there are huge changes happening out there. In terms of co-located hospitals are being built by the private sector on a business model, which we have no difficulty with, and it really is not something that I have any role in managing. I mean, the more capacity the private sector wants to build, I will welcome. I was reported early on as having opposition to it. My concerns about the co-located hospitals related to how consultants worked on the old contract. We could not manage a public hospital system where consultants worked for us, but could, under the old contract, cross the yard to a co-located hospital at any time they wanted. Under the new contract, my concerns have been alleviated. We now know that we have control of that.
But it seems what you're saying is that the whole idea, this was the Minister for Health's proposal to eliminate the hospital, the problem of packed out corridors in A&E wards, that one of the ways to do it is to get the people who run private health care off the public hospital grounds and into private hospitals. This was her way of alleviating that problem. It wasn't about giving developers or private companies an opportunity to make more money on the backs of people's health.
Well, there's 2 issues. First issue is getting people off corridors and waiting lists. Okay, Queuing and waiting is endemic in the Irish healthcare system, and indeed in many others. We all think in Ireland that this is a problem of our Irish system and there's some great system. Nobody's shown me this great system, and I've experienced of quite a few of them. Okay, you wait. I heard people talking about how the NHS is so wonderful. Well, you can wait up to 2 weeks for an appointment to see a GP, whereas we run the best GP services in the world. We run the best long-term care facilities in the world, I believe, in terms of access. But let me just say in relation to, so waiting times, if you bring an elderly patient 4 times to a hospital on 4 different days to line up at a clinic to see 4 different people when all he is one person who's got chronic diseases, then clearly you make queues and lineups, and clearly that's to make it easier for those of us who provide the service. We are putting in a service that says you'll get 90% and 95% of that work done in Ringsend in your local community. The hospital people have to come out and engage with that. That's a massive challenge to all of us, including myself, who have worked in the system.
Then so why are we?
That's how we deal with the waiting
Okay, but if that problem is being resolved, why on earth are we still supporting a co-located system which will allow the building of up to 8 hospitals, private hospitals, on public hospital grounds?
Okay, well, let me just say that I think the whole plan for the co-located system was built on the premise of, from my looking at them, that it's really up to whoever wants to develop co-located hospitals to do that, on the premise that the solution to all our problems was going to be in beds, okay? The bottom line is we were dealing with huge issues at that time. But let it be said now that even in the last year, never mind what we achieved the previous years, waits over a year are now down by 50%. Waits over 6 months are down by over 20% for procedures to be done in hospital. We've collapsed waiting times. We need to do an awful lot more, and we will get rid of them. So that has changed by simply improving our processes and bringing clinical leadership to it. Does that change now because of our success?
Yes.
The model that underlies that really is for the co-located developers themselves. But if somebody builds more capacity, etc., clearly that makes our job easier. But it's not something that, to be fair to the Minister, it's not something that anybody has proposed that we should be funding.
But it is a huge, huge issue, and is of great concern to many people in this country that the ongoing development of more private hospitals in this country simply will interfere with the public health system that we have. It will mean a huge increase in the amounts of money people have to pay for private health care, and in a country of only 4 million, it seems a bit ridiculous that we seem to have such a high number of private hospitals. It's one thing building a private hospital like the Beacon on its own grounds, but the very fact that these hospitals will be side by side the public hospitals and will be using services within the public hospital system, not least their A&E departments, seems, from what you're saying now, to be an unnecessary development.
Well, look, all I would say to you, as I pointed out to you, is that over the last couple of years there have been huge improvements in A&E, which were there when this plan started. There have been massive improvements in the amount of people waiting for procedures in hospitals. A lot to be done, but a huge amount done. There is huge satisfaction from those who use the public hospital system, and this is the irony when you say that people say the HSE doesn't work. Well, the HSE is the whole system, everybody who works in it. And we have to do sampling independently of the people who use our system, not just meeting people on the street. And there is 90% satisfaction rates at a high level for people who use our system. So the system's doing a lot of things right now. The question you're asking me is there a need for this resource going forward? As I say, that really is a business decision, but I will say to you is the complex work in this country, and when people are truly, truly sick in terms of really needing serious inputs from a cancer perspective, from a major surgery and
they'll go to the public hospital.
They'll all be treated in the public hospital because people know that's where. So ironically, while we get accused of being a disaster area, as you said at the beginning, for some reason we've massive satisfaction rates for those who use our services, and everybody accepts we're the place to do the hugely complex work. But for some reason, that success story, that's not the HSE.
So why are we going ahead with supporting the building of private hospitals on public hospital grounds in the co-located system? This was an idea of Mary Harney's. Many people disagreed with it. We saw how the opposition parties in particular used it during the last election. It seems to me you're saying it's unnecessary.
No, what I'm saying is, my concern about any co-located issue related to how consultants would work, there is no point in telling me that if consultants could earn a huge income by people waiting on our list and being moved across the yard for them to be seen across the yard, that I could run a business. That's been sorted.